A little further explanation on the exosomes. So this chart, which again will be on our website, is going to demonstrate that there are something called complementary derivatives, CD. This is what the FDA is looking for to see if these exosomes are consistent in their replication. In other words, the exosome you are sending out today is the same as the one that was the day before and the one tomorrow, and it's there. They use 3 different markers, CD9, CD63, CD81. And in this graph, it shows that Chimera is the only producer of exosomes that has those components. And that's verified by outside sources. That's not them saying that. And it is also verified by the FDA. The other significance about the RNA, the microRNA, is that you have to have that to pass through, because I'm saving your brain, you have to have that to pass through the blood-brain barrier, okay? And these microRNAs don't diffuse through there. They are drawn through the blood-brain barrier by the neurons. It's kind of like, it's crazy. So it's kind of like if you've ever seen a video of a sperm entering the ovum for fertilization. It's like this has a mission, it has a homing, it knows it's going to go there, and that's its whole purpose. And this reminds me of this, of how these exosomes with a microRNA are drawn up through the blood-brain barrier. And again, this is the only exosomes that has been proven to pass through the blood-brain barrier. Now this is why, I know there's lots of people have gone different things. Mexico, they've gone to South America, and they have not gotten good results. The reason is either they didn't have the quality or they didn't have the quantity. And if you look at that graph, you're going to see that's why. Because these other companies don't have the quality and the quantity. And that's why they didn't get the results. I want to share with you a story, a very personal story, about these amino acids and exosomes with a personal friend of mine that I've known for over 40 years. We both went to Logan University. He graduated in the class behind me. I can't say his name for privacy. However, I can tell you he was one of the most successful chiropractors in the world, lectured internationally, was lecturing internationally up to 2 years ago. Huge practice, still has a following. Still, this morning he'll be giving a podcast. He does every Monday morning to his people. And he had some problems. So he came to me a few months ago. We talked, and he told me about this problem he was having. He said, and I may have the dates wrong, but somewhere 18 months to 2 years ago, he got this sudden pain in the left side of his neck. Now, it wasn't like a muscle pain. What it was a hypersensitivity. It was like if you barely touched it, it was like an electrical shock going through him. If the wind hit it, if the sun hit it, super sensitive, but he couldn't wear a collared shirt. So he's wearing, like a t-shirt all the time. And so he can't lecture anymore. He's not going to go, talk to 2,000 people in a t-shirt. So really this has impacted his life. We did other things, and I'll tell you, he had some white stuff in his brain that was suggestive of MS. He had, on his cervical MRI, he had increased signal, which indicated a problem in the myelin sheath on the left, a C2, C4, and that matched C2 dermatome where he was having the problems. He had a neuropathy that had been going on for 6 or 8 months that had been undiagnosed. His blood sugar was at 130. We did a thyroid panel on him, and he had TPO antibodies, so he had Hashimoto's. So and he was 40 pounds, probably overweight, 40, 50 pounds. So we started a process. We started him on the weight loss. He's down 12 pounds in less than 3 weeks. But Saturday, we started him on the specific amino acids to address these different issues, to address his immune system, to address his endocrine system, to address his mitochondria, to help the weight loss, to help get rid of the fatty liver. And then Saturday, we had shipped him 12 trillion, that's trillion exosomes. So he nebulized 5 trillion, he had an IV of 5 trillion into his arm, and he had 2 trillion put into his left neck where most of these pain were. Okay, he had 4 different sites. They went in the skin, they were in that. So he sent me a picture of himself yesterday, Sunday, and he was at his grandchildren's soccer game, and he can't take the sun. He was sitting in the sun was on his neck, the wind was 10 miles an hour, didn't bother him. He said his symptoms there were 60% better in one day. The other thing he told me, that when he woke up in the morning, often his blood pressure was in 150s to 90s. That's pretty bad. You know, that's like pre-stroke. It was 120 over 80. So these are miraculous changes, you know, that I'm seeing in a friend, someone I've known for 40 years. So this is exciting.